You are watching a Fact TV presentation of the town of Swanzey.
Okay, we'll open the meeting May 23rd, Board of Selectmen at Whitcomb Hall.
Make a motion to approve the regular meeting minutes of May 17th. Second.
Motion's been made and seconded to approve the May 17th regular meeting minutes. Any further discussion, additions, deletions? Hearing none, those in favor?
Aye.
Aye.
Motion to approve the non-public meeting minutes of May 17th. Second.
We have a motion and a second for the non-public meeting minutes of May 17th. Any additions, deletions? Hearing none, those in favor?
Aye.
Aye.
Make a motion we approve the consent agenda. Second.
Motion has been made and seconded to approve the consent agenda. Any additions, deletions? Hearing none, those in favor?
Aye.
Aye. Public input. Hearing none.
They don't seem to be approaching.
Michael Jasmin, Code Enforcement Officer.
So we've had some discussion about Ashley in her office for rec department, of course. I was asked to check to see what it would take to revamp the newly finished offices in Town Hall, second floor, like we talked about. It would be at least $6,000 to $8,000. And the other problem, of course, is that we're really busy right now in summer. We've got a lot of town projects and things that I'm kind of in charge of in one fashion or another. I don't have access to DPW crew or the rest of it. It seems to me that the real sticking point, if I'm not mistaken, is the curio cabinet in the office down below. I think very quickly, very inexpensively, I could build a protective box around that in a couple of hours and it would take care of any damage that would otherwise be concerned with suck. It is attached to the wall, it's part of the building. Ashley herself is concerned about damage it might suffer when she endorsed this idea. So, you know, with your permission and cooperation, I'd like to build that box, get her moved in there. She's still working on her kitchen or the conference room that's actually still very popular in town. Still used daily more than once. So we don't want to lose that because it's important. Putting it upstairs in that area, over that area, it's going to make it very hard to access for a lot of folks and start to realize when I see who's using the conference room every day. We're paying a lot more attention to it now that it's a amorphous space. Like I said, she's full time. She's got coming into town hall with laden boxes and books, lays it all out. We're going to pick it back up and bring it back. It just doesn't seem like a very practical way to go about her day. Especially with camp starting and the rest of it. So you can try to go I'll ask you to go back to the original plan and put in that front office, make a protective case around what we're doing independent to make sure all the activities stay in current condition, and then maybe in the winter we can go back to the plan so that we can think a little more clearly about what we may do and how we may do it.
So you see this as a short-term temporary?
I don't know. Things change. You guys may decide. We all may decide. You know, it's working out pretty good. We'll just leave it alone. But right now, we need to do something. This is not. This is a free and paper.
Yeah.
And because I'm going to be stuck. I mean, it's on that way, but I'm going to be charged with helping create a space. I felt I need to come in and kind of let you know what I'm up against in creating a space in town hall.
Okay.
I don't say impossible, but nothing I do politically on it. You let me off the hook on that.
Okay.
At least we carry it. And then we can go over it. We've got a lot of projects right now.
Okay.
Josh's project. This is something. It's going to be another year at the end of the year when we do the town report, where it's going to be another year when we look back at a whole lot of them. And we're only halfway through. We've still got 3 quarters to really get done in the last 6 months.
So basically, the box, you put it around the curio.
Yeah. Yeah, we'll paint the same color to the wall so it looks as ugly as possible, but it's just temporary and protected, and then we can figure out when we have more time to do so. I think actually would feel a lot better. She's gonna have kids in there all the time and things, and they just do some pretty odd things once in a while, and I think she'd be heartbroken if that glass and anything got broken. Yeah, and we'll cut it in such a way that it'll come back apart. It's not going to be torn apart. The material's going to be reused for something else that will be made. A couple simple screws, nothing else. Well, you guys gave her permission, and I worked it out with Deputy Chief Matson, and she put a lot of it in the basement. So far, so good. You know, and everything's a work in progress. I mean, I didn't expect when we did the revamp of town hall, I didn't expect that the conference room would still be identical to our daily workings, but it absolutely positively is. It's really shown itself to be a valuable space that we cannot lose. So, you know, yeah. Yeah. So I think, you know, as we continue to do these things, we learn more about what we do as it relates to the spaces that we create. Which is just good. So that's where we are. So we'll learn about this space and how practical that this space may turn out to just be this dreadful place where it didn't work out at all. But at least we'll know.
I think consensus would be fine at this point.
Appreciate it, guys. Thank you. I'm sorry? I am leaving. Goodbye. Thank you.
We do. June is coming.
Okay, what's your thoughts regarding the June meeting schedule, guys?
So I'm proposing meeting on the 7th and the 21st in June.
The 21st
Is that not right?
or the 28th?
I was proposing the 7th and the 21st. Did you prefer the 28th?
When did you change this?
I don't think I did.
14th and the 28th, no meeting.
Right. Oh, sorry. I think we were saying the opposite. Yeah, yeah. What you said.
Okay, your thoughts, guys?
Works for me. Yeah,
It's in the calendar.
as long as it stays.
Okay? What else we have?
I can do a few updates.
Is there anything else other than that?
Not at this time.
Okay?
So on the West Swanzey Water Company grant, we got a feasibility study grant from the state. We received governor and council approval on Monday, so we're able to start working. So we're looking at setting up a kickoff meeting and some site visits for Underwood Engineer to see some of the infrastructure and do some flow tests on the hydrants and whatnot. So that's exciting that we're finally able to get started on that in anticipation of possible for a town meeting action next year.
Do you think, given the delays, that's a realistic possibility?
I do. We're going to do everything in our power to make it possible.
That and everything else?
Yep. The West Swanzey Water Company has been great, providing a lot of historical documents, so that'll be helpful to get us started. So we're trying to get it kicked off early in June. Richmond Park restrooms coming along very nicely. They're planning to be substantially complete, which to us means flushing toilets by Memorial Day, which was our goal, which is when the lake opens. So if you haven't been by to check them out yet, definitely are going to want to stop by, if not before the ribbon cutting, which we have to schedule, but it's coming along really, really nicely. So it's going to be a huge improvement down there.
Sure will.
Yep. Now Savannah can go back to camp. Perhaps.
No, not happening.
Not happening. Okay, we lost her.
Overnight now.
What's that?
She's overnight now.
Ah, gotcha. Yeah, we can't keep up with that. As Mike was mentioning, the next project that's going to be coming up, kind of simultaneous-ish with that finishing, is going to be the recycling center improvements. So we hammered out a contract and schedule with TCD, and they're looking at starting construction around July 3rd. They were actually ready to start sooner, but Josh wanted a little more time to get information out there. He's got a good notice. It's going to go in Swanzey Uncovered to let people know what they're going to be experiencing, that we're going to need their cooperation during construction, and they're looking at a mid-November substantial completion date for that.
And what was the start date?
Around July 3rd.
Third.
It's a Monday, so, you know, one day on, one day off, so
And everybody else is off.
be a good day to get started.
That's true.
West Swansea AA Park continuing to come along. The main thing they're still working on now is the stairs down to the river, and then the parking lot and the basketball area. Obviously, you know, the pavilion's been done, and Joe's been getting a lot of positive feedback on that and how it looks with in matching with the covered bridge. So that's been a big improvement. And on Friday, I was able to go to the New Hampshire Preservation Alliance biannual conference up in Claremont. Whitcomb Hall received an award, which they'll be presenting locally on June 7th. I also had the opportunity, one of the sessions was a mill yard tour of Claremont, and Chinberg, who owns our mill now, owns one of the mills, and we were able to walk through, see a unit, and if our mill comes out half as nice as that one, we'll have something to be proud of. And they were very complimentary of the town's efforts, especially Sarah, working on the shoreline exemption for the river and the demo grant. So they're actively working on plans, so we can hope to see something soon.
And the sewer plant?
They had a meeting down there today, which I understand went pretty well for a pilot program. So continue to try to find a way to treat the phosphorus. I think Joe's planning to come to your next meeting to give you a little bit better update, but I did send out, it'll cure your insomnia, but a report from Underwood Engineers from their last effort, which was mainly done last year, but was finalized early this year. So that has some information about it.
Are we going to take a look at Pine Street, the property that we own there, and maybe look to either demo it or spruce it up a little bit?
I meant to mention that to you when we talked earlier. So I think you were mentioning 112, the mobile in the back primarily.
In the back and the house on the corner.
So for the mobile in the back, we're 1 year away from the 10-year. People have 10 years to contest tax deeding. So if we can wait until next fall, I think that would be safer. Or we could have Mike condemn it, and just a little bit of a roll of the dice if it were to come back.
Is it salvageable?
I haven't been through it, so I wouldn't want to say. I don't think so. I don't think it would survive a move. And then 120, I guess, would look to suggestions, but we can put it on the list. I think the deck in the back was taken off last year.
It should have been taken off.
Well, it came off.
Voluntarily.
It came off.
Yeah. It did.
So if you have ideas,
One way to do it.
if you have ideas for sprucing, we'd love to put them on the list. We get a lot of compliments on, believe it or not, how nice it looks. So
Really?
we do, compared to its prior status.
Oh,
It's a nice corner lot.
it is a nice corner lot.
It wouldn't take much to make it into a space that the rec department could use, or
To what? I'm sorry.
to have the rec department use that for an office and then still keep our storage.
I think it's pretty well full, and there's no heat or it might be on sewer. No, it's not on sewer. So we need utilities. Yeah.
There was water and sewer there, right?
I don't think so. I think it just goes to I think the campground is tied in from Spring Street.
Oh, no, I mean just as far as the septic.
Oh, yeah. I assume it had a septic, yeah.
So it wouldn't need much.
Could look at that.
Either that or Cutler School.
There's an idea. Those are the highlights.
All right, so now what are we doing? We've got 45 minutes.
Recess and greet our guests as they arrive.
I can declare anything I want. Welcome to Swansea. Welcome to Wickham Hall. It's a hell of a nice turnout tonight. We appreciate everybody getting together. We thought it was a good idea, and this was something that Mike Branley had suggested, in getting together with the providers, the ambulance providers, and the towns that they serve. So without further ado, I'd like to turn this over to Mike Branley, and we'll take it from there.
Thank you, Mr. Chairman. We do have some mics positioned around, but we don't have enough for every table, so if you could either try to speak loudly or we can try to get a mic around to you, we would appreciate that. Good evening. As Chairman Colby mentioned, my name is Mike Branley. I'm the Town Administrator in Swansea. I'd like to give a brief overview of what led to this meeting and why many of you were invited to be here tonight. After that, we'll do some brief introductions, basically just ask people to identify which community they're with, and also the organizations that are here. We've scheduled time for both Rescue Inc. and Cheshire EMS to have an opportunity to speak with the group here for a few minutes. And then finally, the municipalities present will have an opportunity to discuss if we'd like to have another meeting like this, if we'd like to plan any other next steps. While this is a public meeting of the Swansea Board of Selectmen, it's not a public hearing, and the purpose is for a discussion amongst, the entities and the communities present. So for background, on May 1st at 5 p.m., like many of you, I received the call that Deluzio Ambulance, which was our contracted primary ambulance provider, like many of you, was ceasing operations in the next few days. And that Rescue Inc. had agreed to basically fulfill their obligations, which for us meant being our primary ambulance provider. I promptly, I think around 6 o'clock, reached out to Chief Hazelton. We spoke briefly. He confirmed what I was told was true, and we set up a meeting for the next day. During that meeting, we discussed, various operational items, how are things going to work, but what's relevant to this meeting is that Chief Hazelton said Rescue Inc. would be providing that service for 30. He was pretty confident it would be 90 days. But longer than that, they needed a commitment from most, if not all, of the communities involved. I won't speak for him, and he'll have an opportunity to speak to you, but my understanding was that it would take most, if not all, of the Deluzio communities to contract with Rescue Inc. for it to be viable for them to, they need a location, set up operations. So what crossed my mind immediately is, all of these towns just heard that their ambulance provider was closing. They might rush into a decision, and I thought it was prudent to reach out to you, basically to let you know that that decision might have consequences. It might limit other communities' options. So fortunately, we had a board meeting that week. I mentioned it to the select board, and they thought it was a good idea, which led me to reach out to your communities. So basically, we have two contracted options right now. Cheshire EMS and Rescue Inc. There's probably other options, but those two options are the contracted options we're looking at. The other thing that led to this meeting was in that first meeting, Chief Hazelton mentioned that something like this is something that they do with their communities in Vermont, but I thought it was worthwhile to kind of spearhead and get this meeting organized. We also thought it was beneficial from the communities to hear from both providers kind of in one venue, hear the same information, try to avoid misinformation. Swansea's goal of hosting this meeting is to help share some information and let the communities involved know that their decisions may impact their neighbors. So with that, I'm going to list off the communities and some of the entities that are here. Again, just to save time, we're not going to go around the room, but if you could just, when I name your community, just kind of raise your hand so folks know who's here. That always happens. Town of Harrisville, thank you for coming. Town of Marlborough, thank you. Town of Gilsum. Town of Sullivan. Town of Richmond. And Town of Stoddard. Spread around. And then we also have Cheshire EMS, Rescue Inc., and some of our friends from Cheshire Medical Center also are joining us. So with that, like I said, we're going to have an opportunity for both Rescue Inc. and Cheshire EMS to give some information, answer some questions. Can't necessarily, answer every hypothetical. A lot of your local issues you might have to deal with on a one-on-one item. But with that, we're going to do a brief presentation. I believe Rescue Inc., I told you guys are up first. Is that right? So I'll get your PowerPoint keyed up, and Chief Hazelton, the floor is yours.
Perfect. So, thank you for coming out. Can you guys hear me without the microphone? Excellent. Thank you for the opportunity to speak with everybody tonight. And just because almost every face in the room is new to me, I figured I would at least introduce myself. Drew Hazelton, Chief Operations at Rescue Inc. I've been working at EMS for 27 years. Work not as much as I used to, but still work as a paramedic in both Vermont and New Hampshire. And I've been working as a chief for about 10 years, mostly in Vermont, but we do serve 2 towns in Cheshire County, both Finsdale and Chesterfield. Get the right direction. So a little bit about Rescue Inc., because again, you don't have a ton of experience with us. We're a nonprofit organization created in 1966 as a solution to the challenge of how to provide ambulance service to a region. In Vermont, it's very difficult for communities to come together in a shared service model. So the communities came together and decided to create a nonprofit organization to do just that. In 2004, we extended up into the West River Valley area at the request of Grace Cottage Ambulance. We're struggling to serve those communities. So our reach now currently is from Hinsdale, New Hampshire, up to Stratton, Vermont. We're a community partner. We work with all of the fire departments, first response squads, hospitals in our area to make sure these services happen. As we go through the slide presentation, we'll be talking about some of the things that we do. We do that in conjunction with our partners, not in competition with them. As a nonprofit, we have a mission. I don't like to read slides, but I think this is important. So our mission is to serve as a key component of our rural healthcare system and provide the highest quality, risk-appropriate, rapid response emergency medical care and transportation services in our region. Take a breath. Recognize the contribution, determination, and dedication of our volunteers and staff who fulfill this mission, and complement our skills and services with education and training needed to achieve our objectives. That's at the center of our decision-making. That is the way that our board guides our organization, and it's certainly what we focus on. Well, that's a bummer. So we're going to talk about, what we think it's going to cost to operate in this region, but I think it's important that we look at, kind of what we do. We have a lot of experience on our side of the river. We're a nonprofit. We are governed by our board of directors, and we're very responsible with our assessments to our communities. We're very aware that it's very difficult to raise property tax revenue, and we're also very aware that it's not the place that funding for ambulance services should be coming from. As a general rule, we should not be funding medical care that is provided through a federal healthcare system on the property tax dollars. In Vermont, we've been very successful at getting increases in our Medicaid reimbursement rates to a point where we do not have to rely as heavily on the property taxes to cover medical services. So We do a couple things that are unique. We provide a subscription service in our communities. And what that means is that our fixed income seniors, a lot of our patients that have high deductible plans are able to get into our subscription programs. And the subscription program is $60 per household. And what that means is that those co-pays, those deductibles, those things that can sometimes put families in a tough spot are paid through their subscription program. That money gets pooled across our entire region and is a way to, again, fulfill our mission. So we're a nonprofit. We have a board of trustees. Our board of trustees is made up of appointees from each one of the communities that we currently serve. And as you heard earlier, we meet with all of our communities in a town hall style meeting like this every year and at every kind of major turn in our organization. It's very important to us that we're partners with the community and that the decision making is made as part of our community. So this is one of our meetings. We record our meetings. They're online. They're available if you want to go back to see kind of what the story of Rescue Inc. is over the last decade. You can go to Brattleboro Community Television and you can find all of our meetings. So I took this slide from our last town meeting with our communities in Vermont. We're very proud of the services we provide. 6,000 calls, and we have not had a single mutual aid truck serve a 911 call in our community in 7 years. So we take our commitment to serving our communities very seriously. At the time, we had 9 ambulances, staff vehicles, tow vehicles, technical rescue, boats, UTVs, COVID and public health response equipment, and the list goes on. So in order to meet our mission, we do it through a whole bunch of different programs and using a bunch of different staff and techniques, including 911, our interfacility. We have large incident response, event coverage, public health, education, disaster, and specialized rescue. So we're not a little organization. We have 97 licensed medical providers, a total of about 125 staff and volunteers that serve our mission. And this is the organizational structure. We have a training branch, which is the Vermont EMS Academy. We have a special programs, which is currently working on specialized transportation for mental health patients and mobile integrated healthcare. We have our general medical 911 coverage, so our what we call our operations sector. We also have our technical rescue team that goes out and serves people that get themselves into trouble in places they shouldn't be. Our focus is on high quality care. The key to our high quality care is really the people. It's the providers that we have, the longevity of the providers that we have, and the fact that our providers are committed and dedicated to the community. We farm our own people. They're local people that we bring through school all the way through from EMT, or now in Vermont, the Vermont Responder, through EMT, advanced EMT, and then we send them off to paramedic school. So they're community people that are working in the community. We do it with modern equipment, quality education, and we treat our system like a system. Our first response squads, and I say our first response squads, they don't belong to us, but we are part of the system. We're the center of the system, but we support the first response squads that are housed in each one of the local fire departments or fast squads. We help them with training, we help them with education, we work with them on a daily basis. They're as much part of our system as we're part of our system. We do a lot of community engagement. We have teams that cover community events, providing first aid. We do that through our mountain bike teams. We do it through public education campaigns, Stop the Bleed, CPR. We also provide coverage to water rescue or water events, paddling events, sporting events. We like to be involved in the communities that we serve. Again, our people are living and working in the communities. We don't forget about the kids. We have pediatric programs. All of our trucks are pediatric safe. All of our, at both of our current stations, we do offer car seat safety checks. Large incidents. We have an entire group of people trained to manage large incidents, whether those large incidents are mass casualty events, large fires. We have the ability to heat and air condition. This is part of, those are two of a series of 6 tents that we can set up. Those are heated, air conditioned, climate controlled for year-round operation. We also have response trailers that we can do many things with. We were in the city of Keene earlier this winter, providing support to them during some cold times. Well, that one didn't come out very good. We have technical rescue team, supports, again, people that get themselves in trouble in places they probably shouldn't be. We do wilderness search. We're a Vermont state asset for search and rescue. We provide services across the entire state. We have 32 people on our search and rescue team certified by the state of Vermont to respond everywhere in the state. We have a high angle rescue team. Our high angle rescue team specializes in everything from low angle slope rescue to highline operations or rescue out of waterfalls. We have a swiftwater rescue team. We are a type 2 asset for the state of Vermont. We're a federally deployable type 2 for FEMA Region 1. And we currently are running a series of 6 power boats and 2 non-power boats as part of our swiftwater and flood rescue responses. We provide ice rescue to the region. So again, if people decide to get themselves jammed up, we want to go. This becomes important later in our discussion. We spent 2 years, 2.5 years, maybe it was 3 years, with pandemic and responding to the pandemic. Our COVID vaccination team, we stood up statewide. We operated in every single county of Vermont. We operated at 160 different towns, over 62,000 doses, including 5,000 home visits in every corner of the state. Our logistics team managed to stand up an operation that covered every single square inch of Vermont in order to make sure that we were able to deliver to farm workers, schools, and correctional institutions all over. When the COVID treatment came around, we also got tapped to be the provider for Vermont hospitals that were overworked in monoclonal antibodies and other infusion treatments. We staffed 6 hospitals for 7 months. There were regions of Vermont, for example, Rutland, St. Albans, St. Johnsbury, UVM Medical Center, Brattleboro Hospital, where if you were receiving COVID treatment, it was being done by Rescue Inc. providers. We stood up entire wings of hospitals, as well as mobile infusion trailers that went from nursing home to nursing home. We effectively shut down the spread of the Delta wave in nursing homes in Vermont in just under 2 weeks. We did that with staff that we brought in from all over the country. In between things, when we got bored, we spent a lot of time COVID testing. We were working on our unhoused population, trying to make sure that we kept those people safe that were living in congregate housing situations. We did home visits, nursing homes, and certainly plenty of public access testing. So with that, we were very fortunate. We did not receive a ton of direct COVID funding, but we did a lot of work during COVID. We had 7 teams on the road every single day, traveling to all corners of the state. And we were able to take some of that revenue and make some investments. And our big investment last year was to open the Vermont EMS Academy. When we looked at what was happening in EMS across the state after the pandemic, which was a huge challenge not only from an operations perspective, but it was also a huge challenge from a staff perspective. Nationwide, you can get on the internet and you can find ambulance services that are struggling right now with personnel management, and a lot of that is due to what happened during the pandemic. We all put our heads down, we bowled our way through it. We all went home with uncertainty, whether we were bringing a disease home to our family, to our elderly parents, to our young kids. Ambulance services got through the pandemic through just will. But what we're seeing now is a reduction in overall workforce. In Vermont, and I'm sorry, I do not have specifics on New Hampshire, I spend most of my time in Vermont, we saw a 35% turnover year over year in EMS providers in the state. Our next greatest challenge in EMS is personnel. Our next greatest challenge in healthcare is personnel. There are representatives from the hospital here, and I'm sure they will agree that they struggle to find personnel to fill the ranks in the hospitals. As our hospitals are struggling, they're shifting more burden back onto EMS providers to transport patients further to specialty care because things are not available. Our greatest challenge was workforce. As a nonprofit, we had the opportunity to take the one-time funding that we received through the hard work of our teams and invest it into building the Vermont EMS Academy. Recently, as part of what we're doing over here, we've opened a branch in Keene, and we'll be continuing to provide those services here as well. Some of the programs we offer through our academy: EMT, advanced EMT, critical care, paramedic. Paramedic education is not quite available yet. We have nursing programs, phlebotomy programs, technical rescue programs. This year we've run animal rescue, boat operations, confined space for rope rescue. We've run Stop the Bleed, ACLS, PHTLS, PALS, PEP, any other alphabet soup you can think of. You can get on the website, vemsa.org. There's 120 classes listed, and we've started filling the calendar for the new Keene location. Part of what we do is high-fidelity human simulators. So our academy has both adult and pediatric high-fidelity sim, allows us to have our providers work through the call from beginning to end. The lifelike mannequins breathe, have expired carbon dioxide, have pulses, blood pressures, and even tears if you cause them pain. They respond to our treatment, and they're the best possible way to train people that are getting into EMS and provide quality assurance to providers that are in EMS without actually working on live patients. Our ambulance simulator is pneumatically controlled. It moves, shakes, does everything that an ambulance does. It has road noise, vibration, lights, and you can even get a flat tire if we need it to as part of the simulations. If you're ever up for it, I encourage you to go to our Newfane location and check out our sim. So you heard a little bit about why we're here, and the backstory to why we're here is, I think, been pretty well explained. In a very short order, it became pretty obvious that Deluzio Ambulance was not going to be able to continue meeting their obligations. As a long-term partner, we've been working with Deluzio for 50 years. We've backed them up, they've backed us up. We've, in a lot of cases, shared personnel. They reached out to us and said, hey, is there any way you can help us to make sure that there is a continuity of service and to help make sure that the employees of Deluzio Ambulance livelihoods are taken care of. I can't say enough about how welcoming Keene Fire has been. The partnership, again, long-standing partnership that we've had with Keene Fire, working with them. In fact, many of the staff at Keene Fire have been through Deluzio, worked as Deluzio. Several, if not more than several, trained as paramedics at Rescue Inc. There's staff that we trained and certainly worked full-time for us that have moved over to Keene Fire. So our ties are very deep, and I can't thank them enough for how easy they've made this situation as far as giving us a place to operate out of. So what we did do is we ensured that the service was not interrupted. Every single 911 call since the transition has been covered. All of the staff at Deluzio Ambulance are currently employed through Rescue Inc. And are receiving paychecks so their families are taken care of. That was our goal. Our board of directors was kind enough to allow me to say, yes, we can do this for 30 days and up to 90 days if we need to support this region so there's no interruption in your services. Again, as a nonprofit, it helps because it's part of our mission. Taking care of our neighbors is part of what we do. So this is what we're bringing to the table. High quality, risk appropriate emergency response. That's what we're known for in Vermont. That's what we've been doing for 50 years. Long before I was chief, they figured out high quality, risk appropriate emergency response. We have the capacity to surge. We currently are running 12 ambulances on the road today with 97 medical providers. We have the ability to put all of our trucks on the road at any given time. We have a very complex scheduling system along with on-call and backup that gives us the ability to run every piece of equipment if we need to. Again, we do community support. It's part of what we do. We have open dialogue with the people that we work with including the fire departments, police departments, and town officials. If this was one of our town meetings that we held every year, the first question I'd be asking is, what services do you need that you don't have? And how can we help? And you can look at 10 years worth of meetings and you'll see that we ask the same questions every year. What is it that you need that we can do to help? During the pandemic, that was vaccines. During Irene, that was flood rescue. And that's how we determine the services that we provide, by meeting with our partners and filling in the gaps. Our staff live and work in the communities. We intentionally bring people in that have roots in our area. We train them, we take care of them, we provide them with a livable wage and a career path. That's how we have such dedicated, high-quality EMS providers. These people work in your communities, they serve on your boards, they take care of your local sports teams and youth teams. Most of them are on local fire departments, first response squads. And, of course, training and education. You can't have high-quality EMS providers unless you're providing high-quality education to go with it. Honesty, reliability, predictability, safe work environment, and employee support speak for themselves. Our way of doing business is predictable. We show up to every single call. We provide high-quality EMS, and our communities know they can count on us. We don't suddenly change our pricing. We don't all of a sudden go back to them and say, hey, we forgot the budget for an ambulance, will you guys kick in for one? We're predictable all the way through. So again, what's new? New EMS education here in Keene. We'll be offering all the same programs. We're not putting an ambulance simulator in there, but we will be using our high fidelity mannequins over here. So far, those long-standing partnerships that we've had have turned into some pretty great collaboration. We're working closer now with Keene Fire than we ever have. We're working closer with the new rescuing employees that used to work for Deluzio than we ever have. And we're finding some pretty amazing people in both groups. So, coming out of the pandemic, I know there's a lot of federal funding floating around. In Vermont, EMS did not receive direct COVID recovery funds. That's not how it worked for us. In Vermont, federal funds went to each municipality. Some of those decided to support EMS, some of them did not. In our communities, we did not ask for COVID funds to support EMS operations because throughout the pandemic, we maintained our operating model. Our operating model has been consistent for 50 years. There was no reason for us to change the way we did business. So what we were charging before the pandemic is what we're charging after the pandemic, and our communities took their federal funds and they used those for stabilizing whatever was important to each of those towns. What that means is we don't have a big pool of COVID money that we can offer to subsidize EMS. Not on this side of the river and not on the other side of the river. What we can offer is consistency. So I put together some cost calculations because I know in the room there's a lot of select board members and town administrators, and what you all like is spreadsheets. So you don't have to copy this down. I have a handout. So I've learned if I give everybody the handout ahead of time, then everybody keeps their head down and they read the handout. So I'll give you the handout after. This is what it costs to provide service to this area. And what I'm going to tell you is that we have 3 weeks worth of data that we can speak to. We know what it costs to employ people. We know what it costs to run ambulances. Those costs don't change on this side of the river or that side of the river. We know what it costs. This is what it is. It's going to be 1.6, a little over, to run an operation over here to support the needs of the communities. So what we ended up doing for revenue calculations, we have a little bit of data. a little bit of data. You know, one piece of data is not a trend, but 18 days worth of data is what I have to work with. 18 days worth of data says that right now we're receiving $2,681 by average every single day in patient billing revenue. These are real numbers off real calls that have happened in the last 18 days. What that means is that we have to project that number out. Again, we're a nonprofit. We've got to bring our number to zero. $978,747 is what the total value of insurance, reimbursement, and paramedic intercept fees will generate in this system. Unfortunately, New Hampshire, the payers in New Hampshire Medicaid pays 30% of what it does in Vermont. So over here, you guys are up against a giant hole with your Medicaid program. And that is being represented on the screen right here. So we take the population of all the towns. Our math is pretty simple. You almost don't even need a calculator to do it. So we take the total number of revenue that we predict. We think we can get a few grants and some donations to help cover some costs. We have a deficit. We divide it by the population, and we shoot for zeros. That's the simple math that we use when we're trying to tell people what it would cost to deliver ambulance service to your community. Here it is, 14 cents a day per citizen. And before I end, and I think I've probably used more than my share of time, I'd like to make sure I throw a happy EMS week out there to all of our EMS providers, wherever you are. This is a very thankless job. And I'd also like to say that this is about people. So when you're looking at all of the equipment, and we could literally ring this building in equipment, we could block the streets of Keene with trailers and trucks and ambulances. At the end of the day, EMS is a people business. A dedicated healthcare provider serving 24/7 requires people. And I can't say enough about the men and women that are actually currently serving here as well as in our Vermont operation. And I'll take whatever questions people might have. Yeah.
So could you speak a little bit more about, I wrote down that you had dialed up operations in Keene, and I thought it was about training, but then it seemed like it wasn't about training. And of course, for most of us in this room, you know, Vermont sounds great, but it's a little far away. So
Yep.
could you expand on that a little?
Sure.
How in Keene?
So we currently have a staffed ambulance at the Keene Central Station and a staffed ambulance at the Keene West Station that are serving this area.
How many ambulances? Do you have actual ambulances there?
Yes,
How many?
there's one in each. Yes.
And is that, are you considering that to be an exploratory venture that you just started? How long has that been going on, or do you think that's sustainable?
So we moved those trucks over on, what date? May 1st. We moved those trucks over from Brattleboro. They're currently staffed by the same people that were running the Luzio ambulances, so it's the same exact workforce. They're just running different trucks in a different color uniform. Yep. And again, we're doing that with support from Keene Fire. Yeah.
The 90 days, I would assume that your board of directors is going to be looking to see how many contracts you can obtain in order to see if it's a viable solution?
Yeah, so we're a regional service provider. The only way that, and the lead-in was really good, and I should have emphasized it more, we can provide service to a region because there's a cost to having equipment and personnel, and we need a certain mass of call volume as well as a certain population in order to make that viable. So the idea behind letting you all know that we would be here is to fill in the gap and allow for this conversation to happen. So we wanted to make sure that nobody was stuck at midnight on the 1st of May having to make a decision about whether they got 911 coverage or not, but rather have some time to look at what does the data show and what can our decision-making be? So we are here now. Again, we're not sending bills to anybody. That's being funded from our Vermont operation to be here, to give you all time to make a decision as to what you want to do in the long term. So does that answer your question?
Partially, I guess, do you have an interest to be here beyond 90?
We do, absolutely, yes. Our board has decided that, yes, we would like to be here, we'd like to continue to support this region, and we can put together, individual, letters and stuff for boards, but it's a region to us. So we would need the support of the region in order to make this work.
Knowing that there's a lot of factors that go into, I could go with lights too. Knowing there's a lot of factors that go into the calculating the cost, travel distances, runs, number of calls, and everything. Just now that people have had time to do their little math in their head, so you threw out $49.76 per capita. So when we're sitting here trying to decide what our cost is going to be going forward, is it reasonable for the town administrators to say $49.76 times however many people in their town is going to be what we would expect your contract would look like?
Is that prorated?
So we invoice monthly. Yep. Yeah.
Approximately, if you know, what percentage of Rescue Inc.'s revenue comes from the towns as compared to billing the users?
So in our current operation, which is, I can't speak to what exactly would be here in our total payer mix, 17% of our operation is funded through taxes, through property tax assessments. The rest of it's coming through either insurance or grant funding.
Thank you.
Yep.
Was that rate that you had said about 49.76 or whatever, does that currently account for you having all of those, staff and you retaining them? And there's an add-on to that question, is retaining them going to be somewhat dependent on how many towns you get? Like, my thought is, I'm making this up, right? So I'm in Stoddard, they're in Richmond. Richmond says, no, we're not going. Now, all of a sudden, to maintain, is the price going to go up, or do you not have thoughts on that yet?
So the way the math would work, we still would have to have 2 staffed ambulances if we lost a town. So yes, the price is dependent on the number of towns that decide to come together as a region. Things that I also didn't mention is in our costing, we have not only the cost of today's operation, but there's also replacement costs for the ambulances that were built into that slide. And, when the sheet goes around, you'll see that, because it's important to understand that ambulances and ambulance equipment is expensive. And from the day you put a piece of equipment in service, you should be funding the replacement of that. So in our cost, there is funding and replacement of all of the equipment necessary to serve this area. So it's a comprehensive number. There isn't a change in 2 years when we need a new ambulance. That is funded as part of our overall assessment to the towns. And it's the same way we do it in our Vermont operation. Yep. Yeah.
This may be a bit redundant, but to go over what my 2 colleagues here said. If you use the math of 49 times the population, that's basic. We did some quick math here, so if you use 49 times our population, our contract price would be 61,000 roughly.
Yes. I don't know what town, I'm sorry.
Richmond, I'm sorry.
So yeah, based on the population number, we use the census population numbers. So if that's what, yep. Yes.
So, and I apologize for everybody asking questions. So two ambulances in Keene, if everybody regionally said, hey, this is it for us, we love it, right? Is that enough to sustain backing up Keene and then becoming primary in so many different directions? Can you weigh in on that?
Yeah, so the way that our system works is you have two ambulances that are here now, and then we have Keene Fire backing us up, but we also have a lot more resources at our other facilities. So when our system gets busy, we use status system management to move resources throughout the system. So if it is busy here, we will shift ambulances, not when a call happens, but before calls happen. Twice in the last 18 days, the ambulances that were over here were backfilled ambulances that came out of our Brattleboro office. They were already in Keene at the time of the call, but the system is busy, so we use this status system management to shift resources. So right now, we have 4 staffed ambulances out of our Brattleboro office that can be shifted. We have a staffed ambulance in our Townsend office, and then we also have on-call personnel that allow us to fill the entire fleet if we need to. But we do shift those around, and this is also, we're very fortunate to have partners with Keene Fire willing to back up those services with the ambulances they have in Keene. Yep. I think that's all of them.
And during my introductions, I was remiss. I think I missed our friends at the City of Keene. So Chief Farquhar, if you'd like to raise your hand. And I understand Great Brook EMS is also here as well now. With that, I will give the Cheshire County folks an opportunity for their discussion. I'll get their PowerPoint up.
Boys are going to be working it, so. Chad, do you want to come up and just take this, and Chief? But don't move until I'm done. Good evening, and thank you, Michael, first of all, for bringing this all together. I do really appreciate having this conversation. And thank you to the towns for attending tonight. I actually hadn't planned on talking tonight, but 2 of the towns reached out to me to ask me to talk a little bit about background, why we're here, what got us here. So I'm going to do that. I'm going to try to be as short as possible about it so that you can actually get to the chief and deputy chief. Because it's our hope to be able to tell our story, our narrative, as to who we are and what we can do for you and how we can meet your needs. Most of you know us already. We've been here for, over 200, almost 250 years, over 250 years. You know us because of the nursing home. You know us because you've had a loved one at the nursing home. You've had somebody that worked, you may have worked there. You would know us because you may have had a guest that stayed at our Department of Corrections. Or, the sheriff may be patrolling your community already currently. And so we've been part of the fabric of your community for over 200 years. And there's a significant and positive history involving the County Cheshire and local fire and EMS agencies working together to find a service solution. Tonight, I'd like to go back about 3 years ago. And I you know what? I'm excited. I'm excited that Rescue Inc. is here today. I'm excited that they brought this forward because when we walked through the door 3 years ago, there was a level of crisis that was going on in this community and statewide. I mean, think about it. 3 years ago, 40%, even to this day, 40% of calls not being answered in the state of New Hampshire. That's the number that I was told. Last year, interfacility transfers, that the hospital, due to a multitude of reasons, lost 3,500 days of bedtime. We're not being able to move people. So 3 years ago, we were approached by the DeLuzio family to see if we could help them with some pumps and some IV pumps and ventilators for their ambulances. We said, of course we can. Of course we can. And $70,000 later, they had those IV pumps and those ventilators. And we took it out of the CARES funding that came from the prior administration. Funding was utilized to assist with their request. In January 2021, we thought, let's go back. And we set a meeting up with the DeLuzio family to see how else we could help them with their ambulance service. It was at this meeting where the county was asked to take on their business. And in their own words, they said, buy us out. The DeLuzio family felt at this point in life this was the best decision for multiple reasons. The DeLuzio stated publicly that the ultimate goal of those discussions was to close the operation and absorb DeLuzio operation into the county EMS department. The purpose was to replace the DeLuzio ambulance service as an entity serving much of Cheshire County once the DeLuzio's operation ceased. Early on in the discussion, we reached out to Cheshire Medical Center to meet with them, to make them aware that we were looking at purchasing DeLuzio, and if that was to occur, would we be able to take on the IFT contracts, being something is it something that we could pursue? At the time, we were met with a willingness from Cheshire Medical Center to negotiate, and over the next year and a half, as we worked to purchase DeLuzio's, we continued to work with Cheshire Medical Center so that we could purchase the IFT contracts and also get everything in place so that the 911 contracts that would happen and the IFTs, it would be a seamless transition. When the purchase did not happen, and because we had been in development of the ITF contract, Cheshire Medical Center, again, with the hopes of purchasing DeLuzio's ambulance service, we mutually agreed to continue our discussion if we decided to develop a regional EMS service. We still were trying to work through if we were going to move forward with this. Yes, we fought hard, actually. We worked with Senator Shaheen, we worked with Senator Hassan, Congresswoman Custer, and Congressman Pappas, who's not even in our district, to see if we could get funding here. Because when the CARES money came out, it went straight to the state. And we didn't have the opportunity. We were grateful for any money we got, but we did not get the money directly so we could get it out to communities. We fought, we were able to get monies. Our first intention wasn't EMS. Our first intention was to get monies out for small businesses. Over $1 million went out to small businesses and nonprofits. When everything was said and done, it was closer to $2 million with the second round of monies that came through for us. We also sent $1 million back to the communities. The city of Keene received almost $250,000 that they could use however they choose to, on top of the monies they received directly from the American Rescue Plan funding. I could go on and on how we utilized that money, but one of the ways we did it is we felt like at this point we could utilize it to help us set up an EMS system, build an EMS system here in Cheshire County that could support, not take over, but support and evolve over time the ability to care for people that are in need and are having crisis, a level crisis emergency. So, with that being said, we continued our conversation with Cheshire Medical and entered into a contract with them as a primary provider for interfacility transfer, which was a key to some of our budgeting processes when we looked at it in November of 2022. So just a few months ago, 6 months ago. Part of the IFT contract was to develop a 24/7 wheelchair van service. Not wanting to compete with services already in place, we worked with and helped a local provider, SmartRide, to grow, to meet the need. They're an amazing couple that has an amazing story. They have a great business plan and a vision for growth to ensure the wheelchair needs were, again, being met. We did that in about a 2 or 3, maybe a 3-week turnaround to make sure the hospital was getting the needs that they were requesting of us. And to this day, we continue to hear the praise of the smart work that SmartRide is doing to meet the needs that were asked of us. Going back to the initial conversation, the goal has never changed, and the county has undertaken everything possible to ensure EMS services for the county's towns would be available upon the delusion of DeLuzio. That day, sadly, has now come, and as a plan for and intended by both the Delusios and the county, Cheshire County EMS is now fully prepared to meet the EMS needs of any Cheshire County town that invites the county to submit a proposal for EMS coverage. After years of well-documented struggling EMS services, county communities can now utilize Cheshire County's EMS, a local, county-based EMS provider, to meet their citizens' emergency medical services needs. We welcome a realistic assessment and deliberative process at the town level, because that's where it should be happening, to lead the best decisions for each town in Cheshire County. And that's why we're excited about being here tonight, and we can't, again, thank Mike for bringing this together. Local fire chiefs and boards of selectmen need to discuss what is truly the best for their community. The focus must remain, as we all know, on the needs of the people. In the interim, regardless of any individual town's discussion, Cheshire County EMS stands ready and able to provide emergency assistance to any town for any reason. From day one, Cheshire Medical EMS is here to serve and here for our communities when asked. I'm going to turn it over to Chief Spain to lead us, and then I think he's going to turn it over to Chad, Deputy Chief Chad Butler.
Thanks, Rick. Bueller? Why don't you do it? He's my guy behind. It's nice to be here. I have to say, even though I look 200 years old, I was not here at the very beginning. So I'm just here and learning everything about the New England states. Chief, it's nice to meet you. First time I broke it. Okay. So with that being said, we're the new kids on the block. We came into existence November 14th. At that time, we started out with 2 ambulances, 24 hours a day. Since then, we've grown. As of this morning, we have run 897 calls. They've been some 911s. They've been a lot of IFTs. But we're here 24 hours a day. And as you look at it, our coverage is now 24/7, 365. We've entered in, the chief isn't back, with Great Borough to be our backup, and we're also going to assist him as needed. With that being said, you look at, how do you staff? How do we get this done? Well, right now, our minimum staffing is 11 a day. With the addition of Great Brook, it's going to be 13 a day. We will be staffing, or I shouldn't say I'm not staffing, but Great Brook will be staffing one of their ambulances with their ambulance, with their equipment and their staff in our station as our backup for 911. Now you look at it, how we divided that out. We've got 5 ambulances that function 24 hours a day. We've got 1 fly car that is right now at the paramedic level. We're in the process of setting up a 2nd fly car, which will be at a paramedic level. With that, how do we divide it up? Well, right now, we align 2 ambulances, 24 hours a day, to Cheshire Medical. The other 3 ambulances are available 24 hours a day for the 911. When we work with Great Brook, then it's going to be 4, 24 hours a day. So with that, as we look ahead, we look at, I think we went behind, well, okay. With that being said, what's our staffing? Our staffing right now, we have 46 personnel. Of that, we've got 32 that are full-time. We've got 14 that are part-time. As you can see with the breakdown up here, with the years, we've got a total of 658 years of experience. That's not only rural, it's suburban, it's inner city, it's everything together into a melting pot. When we look at this, you look at the EMTs, the AEMTs and the paramedics, we're still interviewing. One of the reasons why we brought so many people here is we are a government organization. We are able to offer a robust pension plan, that's a state pension, Secondly, as far as the benefits are next phenomenal. So what are we looking at? We're looking at a startup. We've only been doing this for 6 months here, but I'm proud of the staff, how they've come together, how they've worked together, and how we're looking for the future. Now you look at the staffing, we're going to staff on an as-needed basis. We're prepared for the regionalization. Next slide. We're prepared for the regionalization. We've got one substation right now, which is up at Maplewood Nursing Home. We're also prepared in the future, in cooperation with the communities, especially the fire chiefs, to actually have more substations. Because from the day I came here, the goal is between the citizens, between the fire departments, between EMS, to have someone there in someone's time of need within 9 minutes, 90% of the time. It's completely impossible to do that from our single location or our 2 locations. This is why we're looking at regionalization. This is why we're looking to expand. This is why we're looking to make sure anywhere in Cheshire County, the people have medical care in the time of need. As you look through this, and you look at, and the chief did a very nice job of breaking down his cost. Cheryl Tromley, who was our finance director, and I have worked tirelessly to look at the numbers for the communities, and the majority of the communities, when we look at it, it'll be 1 to maybe 3 cents a day per capita. We've got a couple outliers that may be a little bit more, but really it comes down to 1 to 3 cents a day. Most of them are in the 1 to 2 cents. We look at our station. Our station's new. We've got 7 sleeping rooms. We've got the capabilities to go to 14 sleeping areas if needed, bunk beds. We've got the kitchen. We've got the education program, which I'm going to turn over to my DC in just a second. And we've got the ambulances. Out of our ambulances, when we look at it, we've now got 6 that are state licensed at the paramedic level. In June, we'll take delivery of our 7th ambulance. So with that being said, I understand we have the 4th of July, et cetera. My intent is by July 7th to have the 7th ambulance up and functioning. The 8th ambulance, probably by the end of the first quarter of 2024. What's special about that is that will be a bariatric equipped ambulance. The beauty of it is with our ambulances, except for 2, which we purchased, everything is brand new. Cheryl has let us get contracts as far as the, make sure that the ambulances are functioning, make sure the ambulances are running. The only thing we have to do for the next 200,000 miles or 7 years is put wheels on it. We've covered everything to make sure that the ambulances are equipped, that the ambulances are functioning, and that's really what our goal is, when the tones go off, that we're able to respond. Now you talk about regionalization. Where I came from was big in regionalization. I was part of MABUS, Mutual Aid Box Alarm System. That covered 6 states. I was one of the people that went down to Katrina in command. We were able to put 900 firefighter, EMTs, paramedics for 6 weeks. We put over 500 apparatus there, and we had it set up. We were en route within 6 hours from the time we were dispatched. So we're looking, I'm very, very pro regionalization. I'm very pro working together, because we have to. Nobody in any situation can handle the increasing amount of ambulance calls. I think if you talk to any chief, whether they like EMS or not, they're going to say, where are the calls increasing? It's EMS. When I was at the National Fire Academy taking a class, I met with Dr. O'Neill, who was the president of the National Fire Academy. And in 2017, he said, Mike, 7% of the population will ever use an ambulance in their whole lifetime. Well, obviously, looking around here, a lot of us are living longer lives. We're living more productive lives. The statistics show that by the year 2030, that 7% is going to grow to over 20%. And I think if you look at the call volume going up, typically 2 to 3, maybe even 5% annually, it's due to ambulance calls. I can't address the severity, but I can tell you to a certain extent the severity is increasing. So we need to be on our toes. And as we look at this, we're prepared in the future as the volume increases to meet that volume. But we can't do it ourselves. This is why we worked with Great Brook at this point to help us out. We're looking for any other organization that wants to help us out because we can't get by unless we have some friends. We can't do it alone. We need everybody in this room. We need all your fire departments. We need your selectmen. We need everybody to work for one common cause, which is to provide appropriate medical care that provides longevity to the patient. That's what we're here for. And that's what we're really all about. In the commitment to the communities, we've talked as far as Swanzey. We are in Swanzey. I've got the okay that we will commit one ambulance to Swanzey 24 hours a day, without question. If more is needed, then more is needed. But we are prepared to increase the amount of staffing as well as the amount of ambulances in cooperation with Great Brook at this point and potentially other organizations to meet that need. So with that, I'm going to turn it over to someone who all of you know, the Deputy Chief. He's been here. He was born and raised here. He's lived here. I'm told he's been in some of your homes. I don't want to go any farther than that. But he is the one who I rely on for telling me what needs to be done, how we work it here, and how we best do it. So I'm going to turn it over to Deputy Chief Butler.
Evening. A lot of familiar faces in here. I think I'd bring a little bit more energy. You guys are getting a little humdrum, falling asleep. I saw a couple people nodding off. You know, I brought a bunch of notes. I don't need them. Some familiar faces all over this room. A lot of us have worked together. We've trained together. We've learned together. What we've built here is no longer just a stepping stone. EMS for a long time has just been a mere stepping stone into law enforcement, to fire departments, other healthcare professions. We have created a career opportunity through local classes that are supported by Keene High School and other regional programs. Somebody can graduate from high school tomorrow and walk into our agency and secure a retirement and a competitive wage and fantastic benefits packages to support their families. Now, it wasn't easy for us to get started. We didn't start with a whole lot of people, but a lot of those people are standing in the back of the room tonight because they care. They're committed to this community. A lot of them left high up on the hierarchy positions in their respective departments and the agencies that they came from because they accepted the challenge of what they believe we are creating here, what we know we are creating here, and that is opportunity. And we are looking to be the catalyst to bring EMS regionalization together as a county and as a community. But we've got to support that, right? You know, we've been divided for a long time. You know, a lot of times the property borders, the town borders has kept things divided. Well, we're looking to be that catalyst reaction to bring everybody back together, working together. I'm going to go the wrong way first, just so you guys remember the last slide. So, we have already been out in your community. Chief and Chris said it perfectly. We've been ingrained in this community for a long time. And those individuals in the back of the room are even browsing for houses. Granted, the economy's what it is, and they're finding a hard time, but boy, are they looking. But we've been out in your communities. We've been partnering with Cheshire Fairgrounds. We did a horse event with them this past weekend. We've been doing community and EMS staff trainings. We've been out to touch-a-truck events. We're going to be covering a half marathon here in Swanzey later this year. We participated with the Bulldog 4 for Fun Run. And to make sure I got there's a lot of Fs. Keene Kiwanis Cool Wheel events, where we partnered with Keene Fire and Keene Police Department in the Sheriff's Office, where we all came together to help educate those kids and to be there and teach them about safety, because that's how you do preventative approaches to what we do. We have car seat technicians. We've sent a number of people to classes to be able to help provide families with the education and the knowledge to be able to securely fasten their children in their vehicles. We have community CPR events coming up this weekend in Westmoreland. We've secured that we will be hosting, or co-hosting, I guess you could call it, with Monadnock High School and Keene High School, where we'll be providing an ambulance coverage for all their home football games. We are also being invited to cover the Keene High School graduation. But we don't just stop at community, we care about the professional as well. Dr. Swanzey has been gracious to grace us with his presence and his education to provide us with further continuing education to adapt these individuals not only to our region, but to look at a way that we can work together to provide better care for all of our communities. We have paramedic Jeff LeBlanc. He's our education coordinator. He comes with a wealth of knowledge. We have been offering ACLS, PALS, and BLS classes. In only 6 months, we've been able to put together a small alphabet soup. It's slowly growing every day. We've secured Michael Hutchinson to teach an EMT class for us this fall, as well as an AEMT class this spring. We are going to be offering continuing education classes so we don't have to keep commuting and sitting in front of a computer painstakingly long hours, watching the screen and the slides go by. We want to get everybody together. We want the communal approach. We want people working together. We have CPR, first aid, stop the bleed, and in the near future, pet CPR classes. Because, well, people got a lot of pets and they treat them like children. It's not a bad thing. And we're going to be putting on clinics. We have a fantastic setup at our location where we can do easy ingress and egress to be able to provide car seat technician clinics for our community families so that they can get the education that they need. We continue, oh, I went the wrong way again. Oh, bear with me. It's 4 buttons on this remote. The long and the short of it is, we are committed to this community. These individuals have come from all over New England to come root themselves in this community because they believe in the regional system. They believe in the county approach. Many hands make light work. It's a term that we've all heard together for a long, long time. Well, let's prove it. Let's make many hands make light work, and let's work together because we are all committed to our community. And so are those individuals standing in the back of the room and out running calls as we speak. I'd like to turn it back over to Chris Coates for final messages.
One thing that wasn't said is that we have said from day one, distance is a problem. So we will work with chiefs as we move forward. We'll work with chiefs because we don't presume to think we know where the best spot is. But as we move forward, can we put an ambulance in an area and have it staffed 24/7 on a regular basis in an area that can serve 3 or 4 different communities? One of the biggest questions we've had always is, what's your backup? What's your backup? We've always said, well, we've got 6. At the end, we're going to have 8 ambulances. We should be able to back our own selves up. But we didn't stop there. We did. I appreciate that Chris Rousseau from Great Brook, understood, came to us and said, I believe in the regional process and what you're trying to do here, and can I be a part of that? And we said yes. And that's when we're working out. That's how we came to that partnership to move forward with their ambulance in our facility, with their staff, with their people. We're also, it's Great Brook, but we're also, a few weeks ago, when we've talked about this, I reached out to the city manager and we came together and we had a conversation. We've also decided to continue that conversation with the chiefs, and I look forward to that conversation because we need to see how we can come together and support this. It's not a bad thing that Rescue Inc. is here. It's not a bad thing that we're trying to do what we're trying to do. because it only makes everybody stronger at the end of the day. It's a great thing what Fitzwilliam's trying to do, and Troy's trying to do, and Jaffrey Ringe staying healthy. That's how we succeed here, and that's what we need to do. And one other thing that one of the towns asked me, and I will address here, is that we have no interest. No, I don't know where some of these things come from, but we have no interest in taking over Southwest Mutual Aid. I don't know how that type of story gets out there, but no. I will tell you this, though. I will tell you that we have been working with them. If you haven't been aware, we are upgrading our infrastructure in our communities for our sheriff's dispatch that goes out to 22 towns. That's $4 million. We were able to take and go out and find grants and other revenues, so it wouldn't be put on the tax base. When they heard about that, they came to us and said, it's going to cost us $6 million to do that. So what I'm trying to do is work with Southwest Mutual Aid, with Shaheen's office, because they're over in Vermont, Sanders and Welsh and others, to try to see if we can somehow work something out so that that doesn't hit your bottom line either when they come and say that, so that mutual aid will be able to go digital, they'll be able to upgrade their infrastructure. Because right now, if it's like us, we had to go on eBay to find some of the equipment to replace it when it broke down, and that's not a good feeling to have. And so that's really the only relationship we have. And I look forward to trying to figure this out as we move forward, because it's never been our intention anything more than just trying to work together and develop something that we all work together. And I look to the chiefs for their guidance, because I'm not aware enough to know what their knowledge is and how they can guide us and guide Rescue Inc. in the city of Keene and whoever else that wants to be part of this journey with us. Thank you.
One thing I would like to say, we brought up about the education. Prior to my arrival, they secured a grant for $200,000. The fall EMT class and the spring AEMT class will be free. It's designated and designed for fire personnel, residents, or businesses, etc. So, you know, as my deputy chief brought out, that we will be putting this out soon, call for applications. Right now, our goal is to teach the class at our Swanzey location, but depending on the size, depending on what we need, we may be looking at other locations. But this is what our goal is, and this is how we're going to do it, as a team, as an organization, as a county. This is what needs to do. Thank you.
Questions? Go ahead.
So maybe this should have been obvious, and you might have filled it in right now, but I'm not from this town. So 66 Lake Street that your house had is where, here in Swanzey?
Correct. Right north Swansea. Just, you know, the guys are really bummed out. We share a property border with Dunkin' Donuts.
I guess my question, with no disrespect, I love everything that I heard, but so you said you would be putting one in Swansea. You really already got 5 or 6 here. Anyway, how many, I think I heard you say that you have a contract with Cheshire. How many are you using in transport that takes away from the number? Like, how many do you have in reserve that are true? Hey, I dialed 911, I need an ambulance. Do you have any idea?
Right now, we have 3 ambulances dedicated to 911 service, as well as we have the 2 ambulances that are currently dedicated to Cheshire Medical Center.
And then as soon as Breakford comes on board, which will be very soon, we'll be on board. And
Not even in this room.
Not too far from you.
yeah.
Where is it?
Outside Hillsborough in a prairie.
Our station is in Hillsborough, but we're going to be moving resources over to the Cheshire Complex.
But I like Hillsborough, that's closer to me. I mean, I guess that's one of my concerns, and I'm not necessarily looking for an answer to this. I mean, a lot of what I'm hearing from both is great, but you get into little towns that are much further away from Keene. Stoddard is where I'm from. Gilson probably is in the same boat, but I'm sure there are others. You know, we're a hike onto the other side of Keene, and I I want to be assured that we're going to set up and establish a service for our community that not only is cost effective, but the most important thing, that we dial 911 and we've got that. I think I heard your 9-minute goal, and your 9-minute goal for start from here is like not achievable. So can you speak to that?
Come on up, Chief.
So when I address the 9-minute, that's in cooperation with your fire department, with your citizens, with the whole group. And as I said, if, say Stoddard, if a couple communities in the area come on board, then we'll look at putting an ambulance there, 24 hours a day. I'm not saying in Stoddard, but in the area.
Right, in the air, closer.
Right. Because I truly understand the distance and the time. And when we look at it, I'm going to use Dr. Swanzey's statement that time is muscle. The soonest we can get there, the soonest we can get aid there, the better off we have. Am I correct, sir? Okay. I was close. So yes. And as we grow, you know, we are dependent as far as call volume. And as the calls increase in the respective area, that's where we're going to go to the local fire departments and say, can we put an ambulance there? Can we put an ambulance there 24 hours a day? Yes, we need sleeping quarters. Yes, we need sprinklers because you can't have anybody sleeping in any location without sprinklers. What can we do? I sure as heck don't know all the answers. But you all know your own communities. You all know what you need. And we need to sit down. We need to sit down at a meeting with the chiefs. I need to sit down and say, what do you want? Not only do you want from response, what do you want from education? And how can we do that to map everything out? Because that's how we sit here and are able to say what we're intending to do. We need everybody together.
Thank you.
Yes.
I've got a question regarding the cost. So Rescue Inc. gave us an estimate of what they would be profitable, but yours seems unbelievably low compared to what. So my question is, how are you going to be profitable? Because I think that the county commission vote requires you to be. And if you aren't profitable, what happens in that instance?
Actually, at this point, Cheryl, could you answer that, please? Could you come up, please? Or
Good evening, everyone. I'm Cheryl Tromley, Finance Director for Cheshire County. And for the last several years, we have been working on the model of bringing an EMS to Cheshire County. It started with, as the Commissioner or County Administrator Coates said, with the goal of working with Deluzio. So we realized that the balance between the interfacility transfers and the 911 is the mix of the funding to work towards the expense offsets of the overall staffing and setting aside monies to be able to replenish the infrastructure that we were fortunate enough to be able to utilize ARPA funds to build and get us to where we are today. I know there have been some questions as well in regards to the ARPA funds and what happens when they go away, but we never built this upon the fact that we would be utilizing ARPA funds for the long-term operations of the Cheshire EMS. We knew that going into taking on the towns that we would have to increase the prices that they were currently being charged with their prior contract. And so on a smoothing basis, we do intend to utilize those ARPA funds in order to help the towns ease into a higher contract price. However, it's not intended that these funds would ever be long-term because we don't bank on one-time monies to support the operations of county funding going forward.
So I guess my question is, how accurate can your estimate be if you have only been in existence for 6 months and you know that those funds are going to dry up or those grants are going to expire?
So we worked with a model, a business model like anyone would getting into something like this. We are, we are government, so we are technically a not-for-profit as well. We're not looking to make money off of anyone, but we did our research. We knew the calls that were coming out of the Cheshire Medical for the interfacility transfers. We knew the calls or gathered the information for the calls that were coming out of the different towns. We then took the information from those to develop the staffing pattern that was necessary in order to serve those particular calls. If we don't receive certain towns, we will adjust accordingly. I mean, we'll adjust accordingly in growth, we'll adjust accordingly. We do this now with our nursing home. We have a nursing home that has enough beds to house 150 residents. Well, we only have 100 residents. We have a budget to take care of 150 residents, but we are not staffing to the level of that budget because we adapt to what the need is there for the services that we're going to provide. And it may be that other people could speak more to this with the statistics of the information that we gathered in order to come up with the models and the staffing needed to take care of the number of calls for the different towns and the interfacility transfers. But that is where the basis of our model and our growth even in our own budget of salaries and benefits for the coming years.
So this is back to the second piece of that question. If for some reason your estimates are off, and you are profitable, I do believe the proposal that we saw in our town said that you're required to make, operating green. If you didn't, because the estimate was off or for whatever reason, are the towns on the hook for the difference? Because that's one thing that I've heard. We have a contracted rate that was proposed, but would the town be responsible for the difference if you didn't operate?
The contracts that have been presented to the towns, and I believe each of them have been, not each of them, there have been some. I can't speak to each of the towns that the county has been out to, but they've been presented contracts that are 3-year guarantee for the 3 years of what it would be. So there would be that is where we intend to use ARPA funds to subsidize those particular 3 years.
And are those ARPA funds available to towns in the county if towns decided to go with rescuing to subsidize that cost? Or are you restricting them only to Cheshire EMS?
I would have to say we're restricting them to Cheshire EMS, yes. I mean, we're utilizing them to support what we are doing.
It's a question that can be asked. It's a question that we could take a look at, but there's processes that we would have to go through to see if that's a reality. Does that make sense? Just like what you have for processes, we would have to go through the same type of process.
Am I supposed to? Okay. I'll go ahead.
So building on that was a great explanation. I will admit that I thought the question was asked because I had a very similar question, and you answered it well, but could you tell me, not within, 1%, I know you don't have the financial sitting in front of you, so you put together a business model, but you are new. How close have you come to your projected run rate and revenue right now of what you're building? You need to adjust business models all the time.
Yeah, I will have to say that I would have to probably, I know, they know more of the run rates of what has happened. I believe that we've gotten almost 900 calls.
Excellent question. Right now, what we projected, we are 200 calls ahead for the interfacility. Our guesstimate is, at the rate it's going, for the next 6 months, we'll be about 400 calls ahead.
And on that same note, you may know the answer to this. So with what you expected to be coming in from revenue on your contract with Cheshire Medical, right, those intertransports, that's really going to fund a lot and alleviate some for towns, like us possibly. Are you getting the revenue you expected? Is that volume high enough that
Actually, yes, we are above our targets right now.
So I have a question on, so outside of your three-year model, right, where contracts have been offered, what can we expect for a cost that has that three-year model? And realistically, we're looking at an equal price to rescue or other services that have been offered once the ARPA funding runs out.
I would have to say, based on the contracts that I know that we have presented to the different towns, I feel what we have presented is a lower price based on a population basis. But I don't want to, I feel like what we have presented, at least for the three-year contracts that have gone out, that it is a lower rate. But, I mean, Rescue Inc. has a great product as well, so.
Well, you answer your question. You said after 3 years, right? Correct. So what we would do is we would do what we're already doing with one other town is we'd look at a rolling another 3 years, and we would take a look at negotiating what that would look like with, maybe there's a cap,
Protections put into place.
Yeah,
Yeah.
so that we can only go here with the CPI.
Yeah, we have one particular town that for the fourth year, they have put forward what they would like to see for protections, and I feel like where we're at is we're looking more to work with the towns of what they want. We may find that some towns don't even want a three-year contract with us, so we don't want to suggest that it's a one-size-fits-all, but we are certainly willing to put in terms for what a continued contract could look like.
Because reality is we've seen the supply chain issues. We've seen the gas prices skyrocket. We know that those issues are real. So how do we balance that all in? It's not abnormal for us to take a look at building some type of safeguards in place for both sides, not just us, but both sides, if there is going to be an increase on some level. And that's just a normal process that we would do with any contract is put in safeguards for everybody that's involved.
Kind of to jump in, because Cheryl and I work together on the budget. From our budget, the town's contributions ends up to be 5% of what our budget is. With that being said, with setting up for the intra-facility transfers, with the 911s, with the other type of programs, we've got $206,000 that have been put in there for this year if we need to use it. If we need to use it, that's the key, out of our budget, which is minuscule. So to your question, how much of this year's budget is coming from the towns with the contracts? It's 5%.
I think to clarify and make sure that I think it kind of sound a little small town, right? It feels like that we're keeping a Band-Aid on the cost of EMS. And my concern is that outside of that 3-year window, is that we're going to be ripping the Band-Aid come year 4. And so we're going to be opening this discussion again to our town, and the rapid increase in EMS costs in the area was clearly $12,000, $13,000 a year. We watched other businesses not have a sustainable business model with that. So I think that's more my question is, where do you guys see that being sustainable business model outside of 3 years without a large increase at that time?
I just want to tack on to the end of it, because I don't think the question is answered. If you aren't operating at a profit because these numbers that you quoted are less than or necessary to be profitable, who's on the hook for the difference since you're required to be profitable? That was another question that I just realized we could get the answer.
And that is where we would be negotiating contract prices, is that we would have to evaluate, we would put in protections, but it would allow for the ability, if there was a necessity, to negotiate contract pricing in year 4.
Throughout the year, and she brought up the nursing home. Throughout the year, and she talked about the nursing home. We have the same effort there that, you have a population that's supposed to be at 150. The budget's for 150, but due to staffing, we're at 100 census. So we have to go in and say, where's the revenues, where's the expenses, how do they equal out? It's no different here. We are watching the baseline so that when we get to the year end, we are where we need to be. That's what we do every single day. It's one of the reasons why this year, if you see from the county, you'll see that there's a 0% increase in taxes to be raised to your communities. I can't say that what Concord will do with the document once they get it, because if you've had evaluations or something, that could happen. But it's our job to evaluate that throughout the year, not at the end of the year, but throughout the year, and come up with solutions if need be, if we're not seeing it where we need to be. It's a regular business model. And so at the end of the year, we don't believe we're going to be where that's it, because we watch this throughout the year for every department.
And I think really where it is we're in just such unprecedented times now. I mean, for us to sit there and say what's going to happen in 4 years, we feel that the model that we've put in line, but under today's economy, is satisfactory to get through to where we want to be in 3 years. But I think that's where we would set in reassurances of, a maximum cap not to exceed CPI or something like that, but that if there was some unforeseen economic pressure that none of us were envisioning was going to happen, that it would allow us to at least come back to further discuss of what would need to happen in a fourth year, or maybe not even. So I'm just saying, I feel for us to say today that we know where it's going to be in 4 years. Hopefully, we're going to start seeing the economy slow down, and that we're not seeing the astronomical increases in the economy and this consumer price index.
I think the concern, and the concern that the gentleman brought back there, is just the fact that there is an organization that was in here, their cost per person is significantly higher to be profitable. And I understand there's transfer. I don't know if they do transfers and get income from that. But I also know that I've sat with a lot of you in our office at the town hall, and one of the things that you said over and over again was Deluzio, was giving sweetheart deals. That's why they weren't profitable. And to be honest, the numbers that we saw from you they were higher than Deluzio, but not huge numbers higher. I guess the concern is that you've got this idea that it's going to be less, and then when we get to that fourth year, there's going to have to be compensating for this quote, because we saw Deluzio not being profitable with numbers similar to what the towns, or at least our town of Richmond, received. And then we're seeing another company that's been in existence for 50, 60 years telling us it costs significantly more than that. So I think that's where the concern is coming from myself, the gentleman in the back of the room, and probably from others in here as well. Because if there's, the towns are going to be on the hook for the difference. You guys have to operate the green. So that's the concern of it. I'm not sure.
Okay. I was going to say, maybe, nothing against the chief. He's got a plethora of programs. He's got TRT, he's got hazmat, he's got wilderness. We are just singularly looking at EMS. That's the difference. Through over the years, 50 years, he does have more programs to offer. And I think he would admit each program costs some money. It does. Yeah.
Not include any funding from this area going to support
Okay. So we are just singularly located as far as for EMS.
So the per capita price of 1 to 3 cents per day, roughly, is what you're talking. Do you have that price without the ARPA funding? I think that's what everyone's getting at. So today, if there was no ARPA funding, what would that per capita price be?
So I'm coming out on more of it's about like $26 per capita.
Don Farquhar, oh, it's very loud, sorry. I'm loud anyway, sorry. It's a little better. Don Farquhar, City King Fire Chief. Just to add some context to the per capita discussion, for a comparator, currently the City of Keene's contracts are, for this fiscal year, are about $32 per person, right? So if we were to look at Swanzey as a comparator, our contract proposal to Swanzey, we're not going to, not that we'd give you one, we just don't have the manpower to support it right now, would be $230,400 a year, right? So as we bill our other towns using the same per capita, Swansea's bill would be about $230,000. If we were to enter into an agreement with Swanzey, we'd have to add more staff. And if we were to add more staff, say we had additional ambulances, like another $1 million. And if we did that, that would bring our per capita, to my somewhat poor math, about $67 per person. And that would bring that contract proposal to $475. So I think that kind of bounds the question at hand, right? Where our contract to Swansea would be $230,000. If we added staff, it'd be $500,000, really. So I think that kind of gets to the question at the table, like less ARPA funds, what does that contract look like? So I just offer those numbers to give context to the broader conversation about what that per capita rate looks like. If that's helpful.
The ARPA funds are, I mean, as we're saying, the ARPA funds are not in this budget. What we bring differently to the table, and I don't want to speak for other agencies, but we have worked with Cheshire Medical to also do interfacility transfers, which is a different revenue source in order to offset the 911s, or to bring different revenue sources in to cover the expenses of the staffing that we need for the programs that we have in place. And that is the model that we have put forward.
Yes.
How much does Cheshire Medical currently contribute to Cheshire EMS's budget? Currently, you don't contribute anything other than they will pay for trips if there is no funding source for them. So they only pay for a service if there's not a billable funding source. How often does that happen? What's the average of that? Again, we've only been doing this for a couple months, so we haven't had a lot. I haven't seen a lot of.
It's usually if we have to do capacity transfers, so because there's no bed placement, that we pay for those type of things, or some of the psychiatric transfers.
Right. For clarity, if you have to move a patient for capacity, Cheshire Medical Center is defraying the cost of that transfer.
If there's no insurance, that will pay for it.
Thank you.
I don't.
Go ahead. Paul Wilder from Sullivan. Like a lot of folks that come from small towns, we're volunteer. I teach for a living. I'm also a Selectmen, EMT, and firefighter. And I'm finding this kind of awkward. I'm wondering if the county has considered that Rescue Inc. might be part of the solution to meet the needs of the citizens of this county. Because what I'm looking at here is, it's like the dating game. This is what we have. This is what we have. And I'm trying to cut through all this stuff, because the reason I'm sitting here is for the citizens of the town. And I hear you talking about this, and you have a person over here who's got 50 years doing this with rural communities, and I'm not sure why we're looking at it as competitors. So I'm wondering.
I don't disagree with that. That's one of the reasons why we said that we're having these conversations, to see how we can move forward, and see how we all can work together to make this happen. It is about care first and foremost. We've said that from day one. 3 years ago, I think I was up in Sullivan, I said, this is what we were thinking about doing, this is what we're looking at doing, and it's about consistency and highest level of care. If we can come to some level where we can all work together to make that happen, that is why that's why Great Brook is here. Because if we can build a network in Cheshire County, that should be the first conversation we're having. So I don't disagree. I like the forum because I want to have this conversation, but it shouldn't be one's better than the other. It should be what can we do to make this community as safe when somebody's in a health crisis.
But are you having those discussions within this 90-day window?
Yeah. Yes. Yep. We started the conversations a week ago, and we're having another conversation this week.
Chris?
Yes. Sorry.
I don't know if this works. What I think I'm hearing is differences in how the models are arrived at in terms of how Cheshire County versus how Rescue came to their capital price. I think that's what I'm hearing. So I guess I'm going to second what you just said. Perhaps if Cheshire County and Rescue would be willing to discuss together how they came about their capital income information, that might help us as towns to understand the different price differential as to what might be town needs. Does that make sense to anyone else? That's what I think I'm hearing. So you said that, Cheshire County said that you arrived at your numbers by looking at the last so many years. You see a call, something calls for a town. I didn't quite understand exactly how that was able to provide their information to the individual towns, or something of a whole. I don't know. But at any rate, I think it's hearing differences in models, and it'd be interesting to me if your conversations between the two entities to either confirm or deny that, and bring information back to the town. Speaking for myself, I'm a select board member in a tiny town, but we want to definitely, on the one hand, have the best process and the best program for our town, and obviously want to be cost efficient. So I think I'm hearing we're all kind of struggling with this, and we want to get the best information we can, make the best decision for all of us.
Okay. Anything else? Yours.
Thank you for all the discussion and the questions. The format was not intended to be the dating game. It was intended to have everyone an opportunity to hear the same information. I felt to have one group come in, to get you guys together was hard enough as it is. So to have one group come in, okay, now they have to leave, then the other group comes in. Some questions are going to be generated. You might wish you asked the other one. So that was the intent. It was not to pit them against each other. I think they did a good job, not making it that. So basically, I think if you didn't already, hopefully you got a sense of why we got you together in terms of how your actions might impact what happens to some of the other communities. So, if 3 towns go with one, the other one might not be available or vice versa. Obviously, you probably all have to go back and meet with either the rest of your boards, but if anyone has any initial thoughts or next steps, possibilities, I think we'd be open to hearing them. Obviously, I haven't heard from my board, so that's important too. But again, we didn't have a result that we were going to all decide to go with one tonight. That absolutely was not the intention. It was just to exchange information and see if there might be a path to move forward. Yes, ma'am.
So I don't have a suggestion of next steps, but I did want to thank the board here in Swanzey for getting us together, because I think it was an important conversation. I heard some really great stuff out of both groups, and I know it does seem like, and probably to them as well as to us, that it's us one against the other, and there are choices to be made, and that's probably unfortunate. But I do appreciate what they both brought to the table and gave to us. So, I agree with you. I think we got to step back, go back to our towns, discuss it. Hope that perhaps they talk a little bit more and come up with maybe an option that we kind of thought about. And then maybe we reach back out, I don't know, our town administrator is not here for Sutter, but, you know, maybe we work with our town admins to get back to you to say, hey, what if we had one more sit down making this up? Maybe it doesn't include that, right? What are we all thinking? I don't know. Just a thought.
That sounds great to me. I don't know about anyone else, but yes, Chief.
So for anybody that wants, I do have handouts, and just to clarify, we don't, and you know, our numbers are not subsidized by ARPA funding. So the big difference that you're seeing is federal funding. But the math here, so anybody that wants one, we have a $50,000 maybe more than that number, so hopefully at least every town that wants one can have one. Thank you again.
Thank you. And I do think we have some water in the back room if anyone wants to grab one on the way out. I know it got warm up here. Our AC seems to be a little on the fritz, but yes, sir.
Because I know that Rescue Wing mentioned that the majority, or if not all of the towns, you have to make a decision to go with Rescue Wing in order for them to even be able to offer service to the community. Is there any way that other towns would be notified if the decision was made by another town, just so we can be aware if an option's taken off the table? Is that correct, Drew?
So we would need a volume of calls from people. Again, our math is very simple. It's the cost of delivering the service minus the call volume revenue, and then we divide that out. So yes, so at some point, so if there's one town of 50 people that has 3 calls a year, that cost is going to be so astronomical we won't be able to. It's not even reasonable. And that's what I mean by having enough call volume and population to support an EMS system. That's the reason why it's probably not practical for each one of your towns to have their own ambulance. Because every single ambulance that you put on the road, as Chief Barker said, is about $1 million a year. So if we needed to increase, you know, if we wanted to put an ambulance in 5 different towns, well, then it's going to cost us $5 million a year, and we're going to have to divide that cost amongst the population. So the more ambulances you put out and crews, the higher that cost is, and the offsetting revenue is not there. So that's why the model we put together was 2 staffed ambulances supported by Team Fire, and we believe, and it's been working with the NGO, it's been working with us in the last 18 days, that is sufficient to cover the call volume here, and it's also the most cost-effective as far as cost of delivery versus revenue that's being generated from it.
If I could just extend those comments a little bit,
I'm sorry.
Just a comment. You know, I think this could be an opportunity as well. People, you know, several years ago we met at Mutual Aid to talk about. Understand that? Sure. Sorry. Several years ago we met at Mutual Aid to talk about the concept of regionalization. I think this is an opportunity for communities to work together. And you know, the chiefs in the room, I think they realize we have a really good mutual aid system for fire, but we don't really have that kind of compact agreement for EMS. And I'm not asking for answers tonight, but my ask is just people work together and maybe work as a system to develop mutual aid agreements. The last thing what keeps me up at night is somebody needing an ambulance and an ambulance not responding just because they're not coming to community to help each other. We're going to get through this, whether it's rescuing the county or both, or all of our outlying partners of smaller towns that have ambulances. I think we all need to find a way to do this together, and that's a bigger discussion that I'd like to put things on.
Thank you, Dr. Swanzey. Chief?
Just extend Drew's comments a little bit in the broader question about who signs with who. From the City of Keane's perspective, you know, we've taken a half step back. We've had several towns approach us to see if we would be entering agreement with them to provide primary ambulance service and also paramedic intercept service. So we recognize that our role in the community is to be supportive and not parasitic. So we really kind of want to see where everything goes and see how the City of Keene best fits in. So I thought that'd just be important to put that out there. And I know a few people, again, have asked us to do primary contracts with them, and we're going to sit back on that and just wait to see how the other decisions are made.
Yes, ma'am.
I'd like to respectfully request we do engage in a second meeting. Respectfully request that Rescue and
would the towns be able to formulate some of those questions and send them to us so that we make sure we're getting all of the things that might be most important to you?
So can I assume that the document that you have to hand out is your proposal? That's how I bring back my rest of my semester.
Yeah, it's summary of the information that's on the slide.
Is there a document you want to send out to the town that has any more information, such as the slide? If that's a PowerPoint?
We'll certainly send that.
Yeah, we can share the slides as well if people want to email me or my admin assistant.
That would be really helpful for other select boards to review as well as sometimes other fire companies.
Yeah, and as I think everyone's aware too, we were recording, probably didn't get a lot of the questions, but the video and certainly the presentation should be available. So that recording will be on our website. It was part of our board meeting, so you might have to skip through the beginning, but it's on our website on the agendas and minutes page, so. This has been being recorded.
So the slideshow and the recording can be pulled off of your website.
The slideshows, I would ask you to email me and I can email them to you. I don't think we'll put those on, but. Well, thank you all again for coming. This was an effort to come out here. We really appreciate it, and we'll be in touch.